So far in pathology, etc., you have seen what acute coronary syndrome is. It is nothing but unstable angina and myocardial infarction together are called as acute coronary syndrome. Myocardial infarction is nothing but ischemic heart disease, so the blood flow to the heart is not proper. So here they are showing you the blood supply to the heart. So in anatomy you have studied the blood supply to the heart. So from the ascending aorta you have this right coronary artery and the left coronary artery. From left coronary you have something called this circumflex artery which is going behind, right? And this is the posterior. So you can see the circumflex branch of the left coronary artery, and the right coronary artery is also giving branches here. So basically this is all about coronary blood supply. This is what it will be affected. So the coronary artery disease will lead to ischemic heart disease, okay? So that will cause myocardial infarction. So what are the clinical features you will see if a person is having a heart attack? You will see that he will have pain, he'll have low systolic blood pressure, he'll have oliguria, he'll have bubbling respiration, breathlessness, nausea, vomiting, syncope, raised JVP, third heart sound, quiet first heart sound, diffuse apical impulse. All this you have already seen, isn't it? In pathology, clinical features you have seen. This is the summary of the clinical features. Then when you go to the signs, you have to do some investigations. You will run an ECG on this person and you will see that this person has an ST segment elevation in some of the MIs, acute MIs. You can remember that there's a T wave inversion and an appearance of deep Q wave. Deep Q wave also indicates that there was a myocardial infarction in this person anytime in life. That deep Q wave will tell you, okay, the other things may go away but deep Q wave will remain. So here they are showing you the ST elevation, okay. So this is about a transmural myocardial infarction, ST wave elevation, etc. you have seen. Here they are showing you anterior MI. This again is showing ST elevation. Then this is showing you inferolateral MI. This is also having ST elevation. Now there is only one which doesn't have an ST elevation, that is this one. Here you can see non-ST elevation, recent anterior non-ST elevation, the subendocardial myocardial infarction. This is the only one which doesn't have an ST elevation, okay. Anyways, then you can also run an MRI on these people. You will see that there is a black area of infarct. Serum cardiac markers you have checked. You can check cardiac specific troponin. This is the most important one. And then CKMB. CKMB2 is to CKMB1 greater than 1.5 will indicate you myocardial infarction. These are the most important ones. That is the troponin and the creatine phosphokinase, most important. Okay, CKMB. This is the most important. So are you understanding, people? What are we talking about? The serum markers. You have CTN, right? So cardiac specific troponin, and then CKMB2. These two are the most important. Which are not important are LDH and myoglobin. Okay, are you able to see myoglobin? It's written down here. Okay, now let's move on. This is the graph. They're showing you myoglobin increases first, but that is not the one. It is not at all specific. What you should focus on is the CTN and CKMB2. Okay. Then we have looked at other things. You can do a coronary angiography, etc. Or in a postmortem, you can find a thrombus, right? Intracoronary thrombus. Basically, the cause of the entire thing. So probably there is a thrombus here or some thrombus here, right? So that's what they are trying to say. Okay, so you will find it in an angiography or in a what? Postmortem. Okay. So let us look at the treatment of myocardial infarction. So what you will do for this guy? You will do a ECG, right? An ECG you will do, and you will also do a troponin measurement. And now you have decided that okay, ECG is having all these changes: ST elevation, Q wave depression, and T wave inversion. Troponin is also raised, etc. So now what you will do? You will give this people standard treatment. Standard treatment what you will give is painkiller. You will give opioid like morphine sulfate, right? Anti-emetic like metaclopramide if he is having nausea, vomiting. Based on the clinical features, you have understood this, right? Then you will give him oxygen because if he's having respiratory issues, right? Then you will give aspirin as an anti-thrombotic. Then Ticagrelor is also an anti-thrombotic. Then Metaprolol you can give if it is there tachycardia or something, right? And then you will put him in a cardiology unit. So basic you have given what and all: aspirin, Ticagrelor, Metaprolol, oxygen, etc. Okay. Now you will check in the ECG if there is an ST elevation or not. Okay. If there is no ST elevation, go here. If there is no ST elevation, where are we, guys? Are you able to understand where we are here? So is there an ST elevation? Is it an acute coronary syndrome with ST elevation? Then there is no ST elevation. That means what you can do is you can no need to reperfuse. Basically, there is no need of reperfusion of the heart muscles, right? So you just give them a anticoagulant like Fondaparinux. Okay, Fondaparinux. You give them what? Fondaparinux, low molecular weight heparin, subcutaneous. They're saying. Then you will give nitrate. Okay, nitrate is what standard you will write. I'm sure you will write even without anybody telling you, right? Nitrate. Basically, it is anti-anginal, and for threatened infarction, they are giving this. Okay, so nitrate they are giving. Okay, consider nitrate IV infusion. That's what they are saying. Fondaparinux, low molecular weight heparin, and nitrate. Guys, did you understand? So if the person has no ST segment elevation, they are giving nitrate. Okay, nitrate they are also giving if they can't do reperfusion. Okay, so it is not just in one thing that you are seeing it. See, like this, if you go also nitrates is coming, where you will give nitrates, and if you go here and you can't do reperfusion, you can't do thrombolysis, etc., that time also they are giving nitrate. So it's very important to understand that nitrates is this thing is going to save you a lot of things. Okay, now let us say you have all the facilities to do a reperfusion. So to the heart, you can reperfuse the heart, and you can save the muscles and all that. That time the first thing they are considering is reperfusion. Okay, so if they have come early, then they are doing a reperfusion. But if they come late, then again they are giving this nitrate and heparin and fondaparinux. Okay, so if they have come early, then they are talking about reperfusion. Let us reperfuse the heart. So how will you do a reperfusion? Like a percutaneous coronary intervention they are doing, and then they are thinking about putting this kind of a stent, etc. Right, that's what they are trying to do, so that they'll reperfuse the heart. Along with PCI, they are always giving this GP receptor antagonist, glycoprotein receptor antagonist. Now, if you can't do this kind of the PCI and all that, then at least give some tablets and do a thrombolysis. That means a thrombus has formed, right? Now, this is the artery, and in this there is a thrombus, right? So now this thrombus you have to lyse. Okay, for lysis of this thrombus, what will you give? You will give thrombolytic agents like Alteplase and Streptokinase. Okay, this is thrombolysis. So thrombolysis you will do by giving Alteplase and Streptokinase. Okay, with that always you are giving Fondaparinux and heparin. Everywhere they are giving this Fondaparinux and heparin. Now after all this PCI or thrombolysis, etc., did the perfusion happen to the heart? Is the perfusion happening or not? So here they are saying the perfusion failed, the thrombolysis failed, then you do a PCI. If thrombolysis failed, you do a PCI. But no, the perfusion has successful, so perfusion has happened. Then they are still considering an angiography, coronary angiography. So basically they will do a contrast, and they will check the coronary vessels, etc., and they will fix if it required. Okay, that will be a coronary angiography. Okay, so basically for these people, they will do a risk assessment, and based on their age, that GRACE kind of, it's called GRACE. Okay, based on their age, the systolic blood pressure, the heart rate, and all that, they will decide whether they are high risk or low risk. If they are medium to high risk, again for those people they will consider coronary angiography. Okay, now there is something called as maintenance therapy. Guys, are you with us? Now that you have fixed all this perfusion and all, you have made the heart get back its blood supply, etc. So now what you should do? You should maintenance you should do. Maintenance you will do as antithrombotic agents like aspirin, Ticagrelor, then you will give anticoagulant like Fondaparinux, low molecular weight heparin you will give. Then for cholesterol lowering or lipid lowering, you will give statins like Rosuvastatin, etc. Beta blocker you will give. ACE inhibitor therapy, that is what is this? ACE conversion, angiotensin converting enzyme inhibitor, right? So Enalapril, Ramipril example, those you can give. So basically what they will do is they will counteract the ventricular remodeling, which is one of the complications of myocardial infarction, right? This kind of ventricular remodeling, it will stop the Enalapril, Ramipril, etc. So you have understood the treatment of myocardial infarction. So this is the entire treatment of myocardial infarction. So initially you are giving antithrombotic like aspirin and Ticagrelor, etc., so that the thrombus doesn't form. But if the thrombus has already formed, then you will give thrombolytic agents like Alteplase and Streptokinase. Okay, this is the difference. Then again, as a maintenance therapy, you will give the antithrombotic so that it doesn't form, that is aspirin and Ticagrelor. Okay, you understood, right? So you should understand that you're giving anti-thrombotic, then you're giving thrombolytic, and then again you're giving anti-thrombotic as a maintenance therapy. Okay, and if thrombolysis doesn't work and all, you have to do a PCI, or you will have to do a coronary angiography, etc., whatever is required. Okay, now let us go to the late management of myocardial infarction. Late management means same thing only. You have to prevent the next attack, right? So you tell diet, lifestyle modification, lipid lowering diet, then stop smoking, regular exercise. Focus, guys, this and all you can do. For anybody, whether they have or don't have myocardial infarction, they can do all this. But if somebody has had a myocardial infarction, what will you do for those people? For those people, you will give secondary prevention. Secondary prevention, that means in PSM you have studied, right? Early diagnosis and management, and you have to prevent the second attack also. Complications you have to prevent. So they are giving anti-platelet therapy, like Aspirin, Clopidogrel, anti-platelet therapy. They are saying beta blocker, AC inhibitor, this you just now saw, or ARB, that is angiotensin receptor blocker. Statins like Rosuvastatin to lower the cholesterol lipid. Additional therapy to control hypertension, diabetes. Then mineralocorticoid receptor antagonist, so that it doesn't retain sodium and water and increase the blood pressure of the person. But you can understand that hypertension is causing the what did they say? See, hypertension is one of the risk factors. So they are saying you have to control hypertension. But in the symptoms of myocardial infarction, you have seen that there will be systolic blood pressure will be less, correct? So hypertension will lead to, myocardial infarction will lead to low systolic blood pressure, which is very strange, right? Okay. Then you have rehabilitation you should do for these people. Standard PSM things you will write. And then you can implant defibrillator in these people, so that whenever their rhythm is not right, it can shock them and give them a rhythm, proper rhythm. Okay, so did you understand, people? This is the long-term management of myocardial infarction. Hope you have understood all about myocardial infarction, guys.